Within the psychiatric field, treatment options rarely incorporate spiritual beliefs of the patient. They possess their confidence in science advancements and improvements in treatments and medications reflect this common conviction. The exigency of this topic lies in the fact of science and religion and the most effective treatment within either of them. The American Psychiatric Association puts their faith in science, whereas majority of people put their faith in a certain religion. According to the U.S. Landscape Survey, only 16.1% of people in the U.S. are unaffiliated in 2007, and this number has only decreased in the past 6 years. This means that incorporating that spiritual aspect will capture the many issues the APA struggles with currently. Offering these constructs while acknowledging a patient's spiritual beliefs, will enhance treatment by making it wholesomely effective. By advocating the incorporation of spiritual beliefs in treatment, the APA will gain credibility and desirability, provide the most efficient treatment, and pursue the most cost-effective solution for their patients and themselves. The incorporation of spirituality in treatment provides an effective solution to the issue of desirability in psychiatric treatment. While medication is commonly used alongside therapy, spirituality provides an important foundation for recovery for a number of suffering people. Harold Hustoff, author of If I Didn't Have My Faith, I Would Have Killed Myself, Spiritual Coping in Patients Suffering from Schizophrenia, specializes in psychiatry and psychology with a renowned hospital in Norway, states that to have the ability to find meaning of life in a situation is important for most people. While there is an ongoing issue of patients' beliefs conflict with that of the psychiatrist, simply support to incorporate their beliefs in treatment will validate this importance that is commonly shared amongst most people, and in turn with increased desirability in psychiatric treatment. The credibility held by the APA is vital to its desirability and will proactively attract a larger population to treatment through psychiatry. Spirituality is common amongst many individuals as a way of coping with life. By advocating the incorporation of spiritual beliefs in treatments will have more positive effects on mental health than before when using medications based on scientific research and findings as a primary source of measuring mental health and improvement prior and after the psychiatric treatment. The most efficient treatment is highly desirable in the psychiatric field because it will in turn lead to the most cost-effective treatment. The integration of spirituality and psychotherapy has been studied before, and many benefits were discovered in favor of the patient as well as the psychiatrist. As a specialist in psychotherapy and spirituality, Renee Hefty has over 15 years of hands-on education in this field, and performed a study that has proven that the incorporation of spirituality brings many benefits to the treatment of mentally ill patients. Patients in his study, entitled Integrating Religion and Spirituality into Mental Health Care, Psychiatry and Psychotherapy, claim that integrating their spiritual beliefs motivated them to firstly participate, as well as increase their willingness to bear pain, to cope with difficulties, and to make sacrifices. The humanistic need for structure is present especially in psychiatric treatment. Patients must be placed on a structured regimen for medications and a routine for therapy. This has been determined to be the most effective treatment in the past. However, spirituality and religion provide the much-needed structure to deal with daily and life challenges. Each spiritual aspect of an individual's life will encourage their behavior and daily actions. Therefore, the benefits that the incorporation will provide a more in-depth understanding for a more effective treatment. Matthew Brown, who is a graduate from the University of Utah, has written articles around religion and current trends for over 20 years. He understands the current attitudes toward spirituality. The attachment of meaning to higher power or deities has been present in daily life through icons and images. Therefore, when treating a client that has been exposed to this on a daily basis, this will provide a sense of comfort and commonality in treatment, while easing anxiety associated with psychiatric treatment. By providing this structure, this attaches more desirability and trust between the psychiatrist and patient that will in turn give the most effective treatment by understanding the patient's behavior to a depth not explored before. Also, by understanding this need and individual needs within this, psychiatrists will gain knowledge of their patient's behavior, therefore providing the correct treatment that works best for their patient. Behavior related to God concepts has been researched in order to predict response in specific situations. Katherine Johnson provides further information in her academic research article entitled Friends in High Places, The Influence of Authoritarian and Benevolent God Concepts on Social Attitudes and Behaviors. Johnson, who is an expert in the psychology field and possesses a strong interest in anthropomorphism, proposes that theorists have found related behaviors in specific situations tied to God concepts, such as a view of a punishing God will reflect an individual's actions through their likelihood to cheat and are more likely to always deem actions such as homosexuality and abortion as wrong. On the contrary, a patient that possesses a God concept as a benevolent God, who is loving, caring, and inspirational, is more likely to have a higher self-esteem as well as higher quality social relationships. These varying God concepts reflect how an individual will react in specific situations, and this can be reflected in that of a high anxiety that may be involved in psychiatric treatment. By providing a safe social environment where the patient feels comfortable and feels as though the psychiatrist not only truly understands their needs and beliefs, but works to make their values to be incorporated into their treatment, will add the desire in psychiatric treatment. This information is more than useful when advocating for the incorporation, because not only understanding the person mentally and scientifically will be beneficial, but also understanding what drives the patient to behave in the way they are choosing is helpful to determine the best treatment. Science is the base of all findings for most effective medications. However, this does not capture the emotional concerns that most experience associated with their mental conditions. The main goal of treatment is a healthy recovery. Therefore, it is crucial to incorporate all mental components in this treatment to succeed and reach this goal. By succeeding with this goal, the psychiatrist is also improving their credibility and appealing to pathos by being actively concerned with the patient's whole set of needs, not only their chemical mental needs that can be altered with medication. More importantly, the psychiatrist is utilizing the most effective treatment plan. When spirituality is incorporated within treatment, the APA will in turn save money due to faster and healthier recovery. Religion is commonly used as a coping mechanism in stressful situations for many individuals regardless of their affiliation. Religion in turn is associated with a higher sense of purpose in life that brings positivity to one's life. Adriana Feder, who is responsible for multiple publications in the area of spiritual coping and PTSD, as well as specializing in 4 areas of major mental disorders, claims in her academic journal article titled Coping and PTSD Symptoms in Pakistani Earthquake Survivors, Purpose in Life, Religious Coping, and Social Support. She claims that patients suffering from PTSD who have a greater sense of purpose in life will in fact benefit from religious practices and will lower their level of PTSD. It is common for psychiatrists to have multiple patients suffering from PTSD because the level of trauma experienced by these patients requires psychiatric treatment. By incorporating spirituality, there are far better chances of recovery within a shorter time, cutting down on cost. When dealing with natural disasters, an article titled Cognitive Behavioral Therapy for Treatment of Post-Traumatic Stress Disorder. Carr claims that the main treatment for PTSD is cognitive behavioral therapy, or CBT. CBT has been used to treat PTSD because it has been the most effective in the psychiatric field, and in Carr's study, many adolescents suffering from PTSD after a natural catastrophe say the CBT is the most effective treatment today. It involves an analysis of the patient's thoughts and feelings in order to determine behavioral problems. It is a common treatment strategy for short-term and very specific problems, therefore is very effective for PTSD. However, if integrated, spirituality and religion are a driving force for most thoughts and values about the world that surrounds them. Therefore, it will be beneficial and an effective treatment to advocate this integration at the patient's discretion. Having the most cost-effective treatment seems to be very important. Therefore, many steps can be taken to benefit both the patient and psychiatrist in this area. According to Matthew Brown, a person's spiritual worldview maps their psychological state, and this confirms that spirituality plays a vital role in a patient's healing and coping process. If more focus was placed on the spiritual aspect of a patient's life, the healing time would be reduced, as well as costs for such services. While this seems beneficial for the patient, it is also beneficial for the APA because time, money, and effort that goes into researching this field of treatment is very costly. Time reduction can be somewhat eliminated due to the findings that spirituality can reduce treatment time and cost. This will also bring more money to the APA because they will have the cutting-edge research about the integration of spirituality and how this is one of the most cost-effective and beneficial treatments, gaining more clients and patients as well as recognition. Brown talks about how if one ignores someone's spiritual beliefs, there will always pose a risk of ignoring an important source of an individual's pain and suffering. This is very true in the mental health field and will only elongate recovery time if ignored. Therefore, increasing costs for facilities and drug distribution and need when the problem may not be chemical but mental. This means that medication will not be as beneficial as therapy and psychological support. While the APA finds the most effective treatment very important, there are other contexts within the treatment that are important as well. In order to make the most effective treatment, cost must be reasonable and as well as desirability in that specific treatment plan. After examining personal accounts of spirituality and healing power of finding purpose in life, it is essential to advocate for this incorporation at the patient's discretion. While still placing importance on science-based findings and the involvement of chemicals in one's brain, understanding one's spiritual base will help broaden the overall understanding of a patient's behaviors. By advocating this incorporation, all psychiatrists will find a more wholesome and effective treatment, leaving them and their patients satisfied in the overall treatment plan.